الكتاب الفتح. Okay, all right. So, what we're going to do today, what I want is, okay, this is again, this is not ideal, so ideally, you should have seen patients and discuss based on real, actual patients, where you can train in terms of how to clerk properly, how to get good information, and so on and so forth. Okay. All right. So what we'll do today is I'll give you a chief complaint, a complaint of a patient. And then what I want you all to do is one by one, you tell me what are further informations you would want to know. So we'll begin with history and then we'll go to physical examination. So what element of history that you would want to know? Everything. And then we'll go through what do you think is the differential provisional diagnosis, what are the differential diagnosis, and so on and so forth. Okay, all right. So, okay, let's begin with the case where there's a child brought by his mother presenting with rapid breathing. Okay, so what we will begin with history first. What are other history that you would want to know? And then we'll go through physical examination. Okay, clear? This is the first session you have with me again.
Yes, sir.
Yeah, all right, fine. So I'll go through based on what whom I can see on Zoom. So it will begin with Irdina, and then after Irdina, Putri Azlan, and then Zakwan, and then Adib, followed by Atikah, then Izzah, then Nik Al-Musawwa, and then Afikah Atirah. Okay, so there's only 8 of you. So there's one more that is not here yet, isn't it? Someone just appeared. Who is it? Okay. All right. So again, Irdina, then Putri Azlan, and then Zakwan, Atikah, Izzah, Nik Al-Musawwa, Adib, and then Afikah Atirah. Okay. All right. Okay, let's begin. Irdina, what are the information?
Just now the chief complaint is only rapid breathing, right?
Rapid breathing, yes.
Okay, right.
What are the information you would want to know?
I want to know the onset of the rapid breathing, whether it's suddenly or gradual.
So is that all you want to know about the onset? Okay, how would you phrase that question?
How would you what, Doctor?
How would you phrase that question? You kan macam mana you nak tanya soalan tu?
Oh, nak tanya soalan tu. Anak puan ni dia tiba-tiba je ke ada nafas laju ataupun dia macam gradual macam mana? Gradual.
Progressive. So is it progressive? So the question should be, there should be 2 elements from your question. First, when and how. Maknanya when tu, rapid breathing tu bila? Hari ni ke, on day of admission ke, ataupun start much earlier? And how is the progression of the rapid breathing? Is it sudden or is it progressive? Progressively worsening. Maknanya nafas laju ni dah berapa lama dan dia macam mana, dia start tiba-tiba terus teruk ke ataupun dia makin lama makin teruk, makin lama makin teruk macam tu. So that should be how you formulate your question. Okay, so the answer would be is over one day but it's progressive. Progressively worsen. Okay, all right. Putri Azlan, what other information you want to know?
Since that it's in 1 day duration, so it's acute. So I would like to know that what triggered it. So my question is like triggered.
How would you ask that question?
Makcik perasan tak anak makcik buat apa waktu lafaz laju-laju tu, ada dia tercekik ke, dia ada makan sesuatu ke, atau dia tiba-tiba je bernafas laju.
Tak bagus soalan. Fikir soalan yang lain. Formulate. So another thing, I really don't like people using terms like makcik, pakcik or something. So because some people get offended when you call them that. Do you like that kalau you pergi kedai, tiba-tiba orang panggil you makcik? You suka tak? You tak suka kan? So no, don't use those terms. If you want to call proper, you call encik, puan, ataupun mother, because she is the mother of the child. Kan? So use proper term. Makcik-makcik ni ramai orang easily get offended. Tapi your question is vague. Not a good question. Okay, macam mana formulate that question? What exactly you want to assess?
I just wanted to know what triggered it, but I can't formulate the words. So I'll try a different question. Puan sebelum ni ada boleh macam rojak ke, doktor?
Tak kisahlah, buatlah apa yang penting. I just want to discuss with you how to actually approach this sort of problem.
Okay. Puan, sebelum ni ada macam history family history. Maksud dalam maaf doktor. Okay.
Okay, fine. Tak apa. Putri Azlan, things will get back to you. Zakwan.
Okay, Doctor. Before I further ask a question, I just want to know about the chief complaint just now, because you said the chief complaint is a child presenting to go to hospital with his mother due to rapid bleeding. So I want to know the age of the child first.
4 years old.
4 years old.
4 years old.
And the duration is 1 day, right?
Duration of rapid breathing for 1 day.
Rapid breathing 1 day, okay. Okay, I want to know about the rapid breathing, the shortness of breath lah. Is it worsen? Does the symptoms worsen at certain time?
No. It's just getting progressively worsening.
Or progressively worsening. And I want to know about the is there any associated symptoms such as fever and cough present?
Okay, how would you ask that question?
Puan perasan tak sebelum anak puan sesak bernafas laju ni, ada tak beberapa hari kebelakangan ni dia demam ataupun batuk?
Okay, I see how you're going, but okay, one problem with you and also your other colleagues in the other groups, so you don't think properly in the sense of macam mana how your think is patchy punya thinking tau. You don't think in a timeline, because every problem, every case, dia mesti ada cerita dia ada timeline dia. You can only diagnose it properly if you understand the timeline in a ni.
Sorry, Doctor, we can't hear you because I think the line is kind of stuck. The video is kind of stuck.
It's the same with the other group. Same with hello? Boleh dengar tak? You lost me just now kan? Okay. So it's the same problem dengan Putri punya question tadi. So the issue is when you hear something, you do not formulate it as how it should have been. Okay. Okay, when you hear, okay, so how you should think is, okay, I always emphasize on students, bila you have a problem, you should always think in the sense of provisional diagnosis and differential diagnosis. So, if you have a patient, 4 years old, boy, no one asks whether boy or girl, kan? Lepas tu, what are your differential diagnosis? Because you can only ask good question if you know what are the differential diagnosis. Rapid breathing, what are your differential diagnosis? How would you organize your differential diagnosis?
Okay, I think for 4 years old boy, I think the most probable is like we can have asthma. We can have maybe kind of pneumonia. And Doctor,
wait. You should think of lain macam ni. You should think, could it be something infective? So under infection, dia ada banyak dia. Pneumonia, infection pun it can be infection of the upper respiratory tract, lower respiratory tract, systemic infection, cardiovascular infection. So satu, can it be something hematological? Yes, it can. So apa differential diagnosis in terms of hematological? Can it be something cardiovascular? So what are the differential diagnosis that is cardiovascular? Could it be just respiratory without any infection? Yes, it can. So what are the differential diagnosis in terms of respiratory? So think macam tu. Bila you think macam tu, baru you tahu apa nak tanya, macam mana nak tanya. And then I always advise students, you should go for open-ended question, not just close-ended. Faham tak? So bila patient datang rapid breathing, kan? Another, if you ask me how I would approach this sort of case is, I say, Mom, stop. Kita balik daripada awal. Anak ni sebelum ni sihat ke tak sihat? Kalau dia sihat, bila dia mula tak sihat? So even though because rapid breathing, you tak boleh tanya apa jadi sebelum rapid breathing tu. You tak boleh tanya macam tu je sebab that onset probably ada benda lain yang sebelum tu. Macam tadi Putri was trying to ask, what is the trigger for that particular rapid breathing? Kan? The thing is you cannot just ask about that. You kena go through balik daripada belakang. Maknanya anak ni well ke tak well? Bila dia start unwell? For this acute event. And certain diseases, you kena tanya, bukan setakat tu, so you dah dapat yang acute ni event, you kena patah balik pula for the past 1 year, 2 years. Macam mana dia punya condition. Faham tak? Baru you dapat timeline. So, I always tell students, I always tell my MOs, I always tell, when I get history, it should always be like that. Stop cerita balik by timeline. Bila dia start unwell? What happens dulu? Baru you boleh dapat clear idea. Because diseases, it goes into phases. Faham tak? Kalau you jump, you will not get appropriate history. Okay, boleh? Faham tak? Okay. Balik pada siapa? Putri Azlan. I'll give you ni lagi. Sekejap, tadi dia dah rearrange my skin ni. So Irdina, patutnya tadi lepas Irdina Putri Azlan kan? Lepas tu Zakwan. Lepas Zakwan siapa?
Saya.
Atika. Okay, alright, fine. Atika, what's your question?
Question tu maksudnya tak boleh dah, mungkin tadi doktor dah explain.
Salah, apa question?
Okay, tak, saya nak tanya. I would like to know if this patient doktor pernah diagnose dengan asma ke tak?
Not good question. You know why not good question? Because that is a very close-ended question. Ada asma ke tak? That is a very bad question. You should not ask that. Do you want to think of other type of question?
Yes.
Apa? What should be a better question?
Puan, anak puan ni sebelum jadi rapid breathing ni pernah ada, boleh cerita sikit tak macam sebelum tu pernah masa tu aktif ke tak aktif ke masa rapid breathing ni ataupun rapid.
So your line, you ask about asthma tadi kan? So what should be a better question? I told you asthma is a bad question sebab it's a very close-ended question. So how should you do to make your question better and more open-ended? You faham tak what's the problem? You don't understand. You don't see yet what's the problem with your question. Your question, idea behind that question is good. Tapi the question itself tu tak bagus. Sebab your question, the answer is just yes or no. You don't want that. You faham tak? You tak faham kenapa saya kata your question is not good?
Maksudnya walaupun kita nak tanya pasal asma tu, that's mean kita tak boleh direct terus sebut asma ke doktor?
Bukan. Do you think asthma is the only disease yang boleh cause this problem?
Tak.
Tak. Do you know asthma ada banyak jenis phenotype of asthma? And some people we don't label as asthma, we label as something else. But it is a type of asthma phenotype. Ada banyak jenis asthma. Ada yang kita panggil multi-trigger wheeze, post-viral wheeze, episodic wheeze, brittle asthma, chronic lung disease. So those are diseases yang lebih kurang sama macam asma. So do you know that ada disease lain yang akan present lebih kurang sama macam asma?
Yes.
Betul tak? Betul kan? Do you think asma and its family ni, asma and its phenotype ni is the only disease that can cause a patient to have recurrent rapid breathing?
No.
Any other diseases that can cause recurrent history of rapid breathing?
Yes, like
Yes.
pneumonia.
Pneumonia, recurrent rapid breathing?
If I'm not mistaken.
Pneumonia cause recurrent rapid breathing. How frequent can a person get pneumonia? Do people normally get pneumonia multiple times per year?
No, except for other certain condition like immunocompromised maybe.
Okay, so the problem is immunocompromised. Not the problem is not pneumonia. Faham tak? So that problem is immunocompromised, immunosuppression, immunodeficiency. Then you should so there are diseases that can cause recurrent pneumonia, not recurrent rapid breathing, can cause recurrent pneumonia, kan? Okay, any other disease that will cause recurrent rapid breathing? Again, think in the line of respiratory, cardiovascular, hematological infection. Apa? Can any cardiovascular disease cause recurrent rapid breathing?
Maybe congestive heart failure.
Heart failure, yes. Lagi apa lagi? Any other cardiovascular?
Oh,
Apa?
just now thalassemia.
Thalassemia, hematological. Lagi?
Yeah.
Infective endocarditis wrong. Infective endocarditis doesn't cause recurrent. It shouldn't be recurrent. If it's recurrent, it's bad lah. Poor diagnosis, poor management. Infective endocarditis will cause you to have rapid breathing, but it should settle once. It should not recur. If it recurs, then stupid doctor lah maknanya kalau jadi recurrent pula infective endocarditis. So what I'm trying to tell you, Atika, is that dia ada banyak disease lain yang boleh cause recurrent rapid breathing, not just asthma. Okay, faham? Okay, so how should you actually formulate your question?
Puan, sebelum yang rapid breathing ni first time jadi ataupun sebelum ni pernah jadi, mungkin dalam sebulan lepas ke 2-3 bulan lepas, maybe dalam 6 bulan lepas. Boleh Puan cerita sikit tak?
Menarik juga soalan tu. So, how you should have asked this question, dia ada dua elemen. Okay, firstly is, sebelum ni ada sakit apa-apa tak? Ada tak any disease? Ada any known medical illness tak on your child? That should be the first question. So open-ended tanya, ada sakit apa-apa tak anak ni? Kan? Kalau ada, you tanya lah sakit apa, you expand that. That's first thing. Secondly, if there is any presentation with similar symptoms. Sebelum ni pernah tak dapat benda yang sama macam ni? So open-ended kan, jangan close kan, jangan pernah tak jadi rapid breathing juga sebelum ni. Lepas tu you bagi pula very restricted timeline sebulan. Kan? You open it up. Pernah jadi tak macam ni sebelum ni? Bila? Berapa kali? Baru you expand. Okay. You want to ask me again? Atika, cepat.
Okay. Puan, anak ni pernah tak sebelum ni pernah sakit apa-apa tak?
Okay. Then the answer is was never diagnosed to have any problem. Never diagnosed to have any disease before. Okay. But the child has had several episodes presenting with similar symptoms. Okay. Next, lepas Atika, siapa My screen is already rearranged. Kita balik pada Putri Azlan tu. Putri Azlan, question. Lepas tu Izzah. Lepas Izzah ni, lepas tu Adib, lepas tu Afika Atirah. Afika Atirah dah belum? Afika Atirah, lepas tu Nur Afika. Okay.
I start daripada mula doktor. Bismillahirrahmanirrahim. Puan datang hospital, cuba cerita apa jadi dekat anak puan. Macam nak tahu like, you know, bagi mak dia bagi tahu apa jadi masa rapid breathing tu. Boleh tak doktor?
Apa jadi tak berapa menarik soalan ni. How should we formulate lah? That question sometimes people will answer just dia nampak nafas laju. So that is not a good question. Sebab it's too broad.
Kalau
you won't get that much information. That question you can ask masa mula. Okay, apa cerita? So dia akan okay, nampak anak dapat laju. Lepas tu baru you go fokus satu. So that question should be from the very beginning, even before I said rapid breathing. Okay, tak apa. Izzah Zahira. Putri fikir
Buat saya nak tanya pasal family history. Puan ada ke macam Puan ada pernah kena macam ni juga ke, ataupun suami Puan ataupun any family members macam?
Again, you are restricting your question to the parents, mother, siblings. So you can expand kan question tu. So your question is just Why are you asking this question? Kenapa?
Sebab maybe possibility of infection kalau dapat daripada orang yang dekat.
Okay, so you are assessing whether it is infection. Is it?
Yes.
Macam mana you tanya soalan tadi?
Saya tanya if parents or siblings ada similar symptoms.
Okay. So firstly is, do you think the child only gets the if it is infection, do you think the child only gets it from his sibling and family and parents?
No.
Okay.
If the child pergi daycare, maybe boleh dapat daripada daycare.
Okay.
If macam ada events, maybe boleh dapat from macam makcik atau saudara mara dia.
Yes. So do you need to list down them one by one?
No.
Tak
So,
payah kan?
tak payah. Jadi so maybe I should ask if there anyone that has similar symptoms that has interacted with her.
Broaden that question lagi. Sebab some people, even with same infection, presents differently. So the question should be, is there any contact with anyone unwell? Faham tak? Sebab this child can get that infection from anyone yang dia ada contact. Dan everyone with the same infection may present with different symptoms. So if you specifically ask, ada orang yang exactly similar symptom dengan ni tak? Sometimes you won't get the answer that you want. What you should want is there anyone unwell yang ada contact dengan this person? That should be a better question. Okay, then the mother will say, okay, ada contact. Other sibling has similar symptoms, but no rapid breathing. Okay, next. Nick. Lepas Nick, Adib, lepas tu Afikah Atirah, and then Nur Afikah.
Yes, okay.
Right.
I want to ask. Masa ada rapid breathing tu, apa yang child tu sedang buat? Good question. Tak good eh.
Masa rapid breathing tu apa cara tengah buat?
Means nak tahu dia punya severity. Means at rest ke ataupun after exercise ke?
The child was resting.
Okay, resting.
Sitting down.
Further ke doktor? Boleh tanya lagi ke doktor?
Tak, satu lagi.
Okay.
Sekejap. Give me 1 second.
Okay, doktor.
Okay, alright. So, macam mana? What's your question again just now?
Masa apa yang anak puan sedang buat masa puan sedar dia ada nafas laju.
Okay, so I was telling the child was resting down, sitting. Okay, alright. Fine. Next, Adib Irsyad.
Puan, anak puan ada sakit lain tak puan selain daripada sesak nafas ni?
What are you trying to get?
Associated symptoms.
Cuba tukar term yang guna. What do you mean by sakit lain? Sakit lain apa? Sebab if I ask you ada sakit lain tak? What would you understand?
History of other illness. So
kan?
Is it okay, doctor, if I use the word symptoms?
Symptom, tapi bila you tanya dengan parents, you tak boleh guna symptom lah. Actually, symptom is an English word, so it should be okay ideally, but not in Malaysia lah. Malaysia tak faham symptom tu apa lah.
but then it would be specific lah kalau I ask the parent, puan anak puan ada ke demam ke, batuk ke, ataupun sakit dada?
Okay, is there any way you can, okay, this is the thing that I told you all just now. I think kau tak dengar lah I cakap apa. Didn't I told you? Bila you ask question, you need to ask. The patient is well before, we presume. So when did the child start to become unwell? What was the symptom that begins first? No one asked me yet. Dia sebelum ni, dia tak sihat ni, dia mula dengan apa dulu? Dia mula dengan demam dulu ke, dia mula dengan batuk dulu ke, or is the only thing ada is just rapid breathing? No one asked me yet. I have told you earlier, when you get something, there's a problem, you kena dapat timeline dia. Dapat progression of the disease. What is the initial symptom yang ada? Initial symptom, dia present dengan apa dulu? Lepas tu you ask the progression of those symptoms. Faham? That should be how you ask. So your question adik should be, anak ni sihat kan sebelum ni? Okay, bila dia mula tak sihat, dia jadi macam mana? Apa masalah lain? Okay, kalau you nak tanya that question, dia kena ada apa-apa masalah lain tak selain daripada nafas laju? So bila apa ada sakit lain tak? People will understand sakit tu in terms of disease, diagnosis, rather than sebab sakit, it can either be disease or it can either be pain. Because fever is not sakit. Fever, cough is not sakit. Faham tak? So your question should not be ada sakit lain tak? Your question should be ada masalah lain tak? Ada simptom lain tak? Selain daripada rapid breathing, any other problem? Any other issues? So that should be the question. But what I want you to ask is actually the timeline. Get the timeline right. Okay, so what I can say is for your question is there is fever and cough. Okay, Afika Atira. And then Nur Afika.
Okay. In Malay ke or English, doctor?
Tak kisahlah, you can even takalam Arabi, I don't mind.
So there are associated symptoms with fever and cough alongside with the shortness of breath, right? So I would like to ask regarding the shortness of breath itself. Does your children having the difficulty of breathing like during at rest or during doing some activities or during feeding?
Not a good question. Because your question, the answer will be yes and no. Faham tak? Cuba try broadkan your question. Maknanya okay, your question should be okay. Patient ni ada shortness of breath, ada rapid breathing. So what worsens that rapid breathing? Anything that causes worsening of the rapid breathing. Anything that you do that will reduce or improve or lessen the rapid breathing. So that should be how you ask question. So you always start with an open-ended question. Tapi in Malaysia especially, not all people knows how to answer well. Orang Melayu Malaysia ni we are taught to not speak banyak, jangan cakap banyak kan. Cakap banyak nanti jangan cakap banyak. So we are not taught to speak. So sometimes kita it's not that easy to get open-ended answers. Kan? So but you need to try. So you kena broaden kan. Lepas tu baru you fokus. Kalau mak kata ada, then you fokus lah, okay, apa keadaan dia? Dia exercise. Then you ask about that exercise, macam mana the severity of the exercise, grading dan sebagainya. Tapi you always start with an open-ended question. Okay.
Can I try again?
So you want to try again? Okay, yep, alright.
Okay, how would you say about the progression of the shortness of breath during the 4 days?
So what are you trying to get? You nak tanya apa ni?
I nak tahu the severity of the shortness of breath tu.
So your question is what is the progression? Do you think the mother can explain the progression?
Dia akan jawab, expected answer would be makin teruk or
So from the very beginning I said it's progressive kan? It's progressive. It's the rapid breathing is is on the day of admission and it's progressive. So it's getting worse.
how severe is severe? I mean,
Okay, macam mana nak tanya? Macam mana nak tanya?
Back to my early question just now, do you notice that he's having should I make it in still open-ended question?
Yes. You can even ask things like, what do you mean? Atau explain explain what do you mean by the rapid breathing being more progressive? Tahu tak? So bila parents cakap okay, it's progressive, dia makin teruk, then you tanyalah makin teruk macam mana? What do you mean by makin teruk? Kan? Apa dia boleh buat sebelum ni, sekarang tak boleh buat. So those should be your question. Sebabnya there's few problem kalau you tanya spesifik macam you tanya tu. First, you may be feeding the terms into the parent's mouth. You yang bagi word tu. Orang Malaysia ni sometimes dia tend to bila kita tanya dia jawab yes. Dia tak nak fikir dah. So that's the problem. Okay. Sorry. Ni kena bayar esok. Kena bayar ni 500. No. Okay, alright. So satu, you may feed the words into the parent's mouth. Secondly is you won't get ideal information that you want. Faham tak? So again, start with open and then you focus on things that you should want.
Okay.
Nur Afiqah.
Yes, Doctor.
Your
Can you
question.
hear me?
Yes.
Okay. Saya nak tanya pasal, boleh jelaskan lagi tak pasal demam dengan batuk ni?
Okay. What are you trying to get?
Characteristic of the cough and the fever.
Boleh jelaskan lagi tak? Okay. Alright. So how I would ask the question usually, because jelaskan lagi ni sometimes it's just regarding that fever. How I would ask that question is, boleh cerita tak demam batuk ni macam mana, bila dia mula? So because it's not just about explaining. It's about we want the parent to tell us the timeline, the characteristic and so on so forth. If you just jelaskan, dia akan kata okay, fever ni is high grade, fever ni low grade, ada chills and rigors. Cough dia macam mana? But we don't want to know just that. We want to know the progression of the disease. Demam ni start bila? Cough ni start bila? Cough dulu ke demam dulu? Macam mana characteristic of the fever? Macam mana characteristic of the cough? Progression of the disease? What did the mother do? Kan? Do you think mothers will do nothing bila anak dia ada demam?
Tak.
Mothers will do something kan? So that is why get the ceritakan what happened dekat rumah rather than jelaskan, because jelaskan just an explanation about that particular problem. Jelaskan about demam anak ni, mak dia jelaskan lah, demam ni tinggi, ada chest rigors, ada apa kan. But if you ask the mother to tell what actually happens dekat rumah, macam mana keadaan dia, faham tak? Dapat tak? Okay, so the answer would be this patient had fever 2 days prior to the rapid breathing. Moderate grade probably. There's no documented temperature at home. Mother gave some paracetamol. The child responds to paracetamol, but fever recurs back after 6 to 8 hours. And then there is cough. And then there is cough. Okay, all right. Now it's an open floor. Any other question you would want to know?
Doctor, I have two questions, Doctor. The first one is specific and the second one, the first one general, the second one is kind of specific lah. Okay,
Yes.
First one I want to know about the Puan, macam mana selera makan anak Puan? Kebelakangan ni. Puan.
Tak dapat lah. Is it mine? I think my internet connection ke? Orang lain dengar tak clearly Zakwan cakap apa?
Dengar.
Dengar. So it's my internet connection ni. Apa Zakwan, you want to try again? My internet
Okay.
I mean our hospital, the internet connection is patchy.
Okay. I have two questions.
Yeah.
The first one, Puan, macam mana selera nak makan macam mana selera makan anak Puan dalam 2-3 hari ni Puan?
Okay, reduce appetite.
Reduce appetite. Boleh Puan cerita lebih sikit reduce appetite tu macam mana Puan?
Dia tak mau makan. Minum pun tak berapa nak, kena paksa.
Okay. Okay, dan saya nak tanya lagi. Berkenaan dengan macam mana pula dengan batuk anak Puan? Puan ada perasan apa-apa kahak ke ataupun macam mana?
Okay, there is it sounds like a wet cough. Do you think 4 years old child can expectorate?
It's kind of hard lah, difficult lah for them to expectorate.
They won't expectorate kan? So how can you assess whether there is any mucus or not? Ada phlegm ke tak? Color of the phlegm. Do you know how we can assess? Is there any way we can assess that?
We can do chest physiotherapy.
Oh, itu kita assess dalam ward from history.
I know. Maybe we can ask the mother whether she heard about the bunyi kahak tu kot, Doktor.
Okay, so bunyi tu you can assess whether it is productive or not, or dry cough. Okay, but what else can happen? So Adib says children always swallow the phlegm kan? So what will happen next?
No sputum.
Apa? Postassive vomiting. Dia batuk and then dia vomit. That's usual, that's common kan? Dia batuk, dia vomit. Dia batuk, dia telan the phlegm. Phlegm goes into the stomach. Phlegm doesn't easily pass through the stomach into the duodenum. Sometimes it may get collected in the stomach and then the patient will vomit it out. So ada postassive vomiting tak? Vomitus dia containing apa? Ada tak phlegm dia dalam vomitus? What is the color of the phlegm? So those are questions that you should have probed. Okay. Alright. Any other question?
Saya nak try tanya. Since dia ada batuk, ada demam, mula simptom-simptom ni, ada tak pun perasan something lain lah dekat cara dia batuk tu? Ada changes ke dekat dada dia ke? Ada any changes yang puan perasan?
What are you trying to get?
I'm trying to get the, actually the idea is the chest recession, chest indrawing.
Okay, okay. This question now this is better asked with the close-ended question rather than open-ended. Sebab changes pada dada dia, it's a bit difficult for them to answer in that sense. Okay, mungkin bolehlah nak tanya, okay, ada perasaan apa-apa perubahan tak dekat dada dia ataupun ada perasaan apa-apa kelainan pada dada dia, probably okay. But for this specific question, I would straight away ask, ada nampak lekuk-lekuk tak dekat dada dia, because we specifically want to know whether there's any indrawings. Kan? So you are trying to get the signs of respiratory distress, which are nasal flaring, tracheal tap, intercostal recession, subcostal recession. That in itself, those are specific items that you would want to know. Is there any other component of respiratory rate, respiratory distress yang you can ask? So open-ended questions are good for things dia ada multiple benda. Faham tak? Tapi respiratory distress ni ada signs lain tak respiratory distress ni? Ada benda lain tak yang you boleh nak tanya?
Dia ada yang macam doktor cakap tadi, dia dada lekuk, lepas tu nasal flaring, grunting.
So those are specific signs. So when specific signs, it is okay for you to use close-ended. Because those are specific things yang you nak kena checklist. Tap. So those things you can ask close-ended. Ada grunting tak? Sebab kalau you tak ask grunting, people will never tell. Napas dia macam mana, ada bunyi tak, ada tak bunyi macam because you specifically want to checklist. Grunting tak ada. You specifically want to ask nasal flaring ada tak? You specifically want to ask whether there's any tracheal tap. You specifically want to ask whether there's any intercostal and subcostal recession. Those are specific items that you should have a checklist. So those checklists you should ask close-ended question. Faham tak? So benda yang you just nak tanya, you nak tahu broad, you ask open-ended. Benda yang in terms of specific question, for example, if you are thinking about meningitis, if your diagnosis is meningitis, you need to ask certain questions. Projectile vomiting, irritability, high pitch cry, neck stiffness, conscious level. Those are close-ended question. You need to ask close-ended question. Maknanya this sort of question, yes, you bagi chance pada parent untuk cerita in an open-ended way, but you still need to ask close-ended. Sebab dia adalah checklist. Tick. Faham? Okay. Clear? Okay. Any other question?
Jadi jawapannya doktor?
Jawapan dia yes, there is. Dia ada nasal flaring, dia ada subcostal recession, dia ada intercostal recession. In your sort of question, dia ada satu lagi elemen yang you nak kena tanya sebenarnya. Selain daripada that acute event. Tapi this won't appear in history lah, dia akan go to physical examination. Chronic changes. What are chronic changes in the chest?
Barrel chest.
Yes?
Chest expansion. Barrel chest.
Barrel chest. So barrel chest and chest expansion is different. So what is barrel chest? Barrel chest is increased AP diameter. Biasanya chest kita kan kembang ke tepi, bukan kembang ke depan. Kan? Perut je kembang ke depan. Kan? Tapi in patients with chronic respiratory problems, there will be increased AP diameter. So AP diameter tu is more as compared to dia punya lateral diameter tu. Kan? So but not just chronic asthma, chronic lung disease, BPD, also even meconium aspiration pun boleh present macam tu. Apa lagi? So barrel chest lagi? Apa lagi? Changes that suggest chronic respiratory problem.
Hypoxemia. Hypoxemia signs.
Okay, what are you trying to get? I'm asking the changes because of chronic respiratory illnesses. Apa?
Maksudnya the air cannot like the
Yelah, tahu.
like not
Cyanosis.
What can you see? What can you see?
anemia, pale.
Cyanosis dia kata bluish.
Anemia pale is wrong. So anemia pale can be because of a chronic illness, not necessarily just because of chronic respiratory problem. Chronic respiratory problem actually you can get polycythemia. Apa lagi? What are the changes? Physical changes? Cyanosis, no, wrong. Cyanosis is totally wrong. Chronic respiratory illnesses don't usually cause cyanosis, unless diseases yang boleh cause cyanosis. What else? Pectus deformity, pectus carinatum, pectus excavatum, Harrison sulcus. Kalau yang ada allergic rhinitis, you can see salute sign. Apa lagi? Clubbing. So those are changes. Okay, alright. Any other question lagi? Apa lagi? Apa lagi?
I want to ask if there is abnormal, the sounds of the cough is, how is the sounds of the cough? Is it like a barking seal or a whooping cough?
Okay. Cuba you try formulate that question like if you are actually clucking the patient. Macam mana you akan formulate that question?
Puan, macam mana batuk anak puan ada bunyi macam menyalak ke? Betul ke?
Okay lah, boleh lah. So macam mana bunyi batuk tu? Tapi you kena formulatekan lagi lah. Bunyi macam menyalak tu sometimes a bit difficult. And then you tak boleh cakap ada bunyi macam anjing pula kan. Orang Melayu macam offended kan. Orang Melayu macam offended. Kalau non-Malay dia kata oh comelnya kan. So but so sometimes you kena formulate it better lah. So what I usually do is macam mana batuk tu bunyi dia macam mana. Tapi you kena tunjukkan. So barking cough tu macam mana? So bunyi batuk tu ada bunyi macam kong macam tu tak? Kan? Ataupun batuk tu kalau whooping tu macam mana? You need to explain whooping tu macam mana. So people don't understand whoop. Kan? Kalau whoop kat Malaysia ni orang faham burger je. Apa whopper kan? Dia tak faham yang whoop tu macam mana. Apa nama, so whoop ni you kena show. Whoop ni macam mana? Whoop ni macam mana? Ni. Whooping cough ni macam mana?
Macam mana nak bagi? Dia bunyi
apa salah? Sekejap. Macam mana you nak tanya?
batuk puan ada bunyi macam apa? Oh,
So what do you understand by whooping cough? What do you understand by whooping cough?
Dia bunyi macam, alah bunyi macam mana cakap? Dia batuk dia ada tarik sikit macam mana?
Anyone wants to try whooping cough?
Doctor, can we just open YouTube for her? Whooping cough.
No lah.
Best.
Tak. Kalau everything you want YouTube, then we don't need doctors lah. Kan?
Doctor, saya nak try.
Okay, yes.
Whooping cough ni contoh lepas batuk-batuk tiba-tiba dia macam tarik nafas banyak terus dalam. Macam tu dah.
Okay, lebih kurang lah. So dia ada few elemen. Dia ada satu, dia ada paroxysmal cough. Maknanya dia akan batuk panjang, ada macam panjang, chronic, dia ada macam apa, continuous cough. Cough usually comes in cluster. No one batuk, cough sekali, stop. Cough usually comes in cluster. Dia batuk is common. Cough biasa datang in cluster. But for whooping cough, dia akan ada prolonged bout of cough. Cough dia tu continuous. Cough, dia susah nak berhenti. Batuk, cough. Followed by deep, high pitch punya inspiration. Cough. Cough. So that's whoop. That's inspiration tu yang that is whoop. Faham? So you need to explain lah, tunjukkan. Faham? So satu, you cannot just show YouTube. Second, you cannot just ada whoop tak? Ada paroxysmal cough tak? No, you need to be able to explain what do you want. Ada barking cough tak? Ada batuk, ada bunyi kasar tak? Kong. Ada perubahan suara tak pada batuk dia? Batuk dia ada tak? Dia batuk panjang. Lepas tu dia tarik nafas. Dia cough. Dia tarik nafas macam tu. So that is whoop. So you need to be able to show to the parents. Okay. Faham? Lagi? Apa lagi? It's already 57 minutes. I don't like to do classes more than 1 hour. I don't care because I think after 1 hour people cannot focus anymore. There's so many things for me to discuss with you sebenarnya ni. Mungkin sebab baru lagi lah kot. Tak apa. We need to arrange another session. I don't care. Alright, apa lagi?
Doktor saya nak tanya. Immunization history dia complete tak?
Yes, that is a very good question. Yes, complete.
Okay.
Lagi? Apa lagi? Any other questions?
Does the patient have any wheezing?
Doktor. Saya nak
Okay,
tanya.
jap. Stop. Siapa tanya tadi? Last kali yang tanya pasal wheezing ni. Siapa tanya? Zakwan. Okay, that's a very good question. No. That's a very good idea that you want to get, but question tu I don't quite like. Again, I always say you can open-ended dulu, lepas tu baru you close-ended. Baru you close kan, baru you targetkan apa yang nak pergi. So, do you what specifically do you want to get sebenarnya?
About this question, I want maybe to rule out asthma lah.
Okay, alright. Is there any other audible breath sounds that you can assess other than wheezing?
Stridor.
Yes, stridor. Lagi? Rongkai and wheeze sama lah. Lagi? Rongkai, wheeze, stridor, stertor, snoring, hoarseness of voice. So dia ada banyak changes in sounds yang you nak kena assess. So in this sense, walaupun wheezing tu is part of checklist juga, tapi in this sense you cannot ask straight away. You kena bagi open-ended dulu. Kalau tak dapat baru you pergi close-ended. So open-ended maknanya ada bunyi tak? Ada bunyi berbeza tak pada pernafasan dia? So that should be how you ask. Any other abnormal sounds when the child is breathing or speaking? Faham? Lepas tu baru kalau mak kata tak ada, dia tanyalah, ada bunyi macam whistle tak? Sebab orang Melayu tak faham wheezing. For Malaysian, wheezing is a medical term. Wheezing is not a medical term. Wheezing is an English term. Orang kampung kat UK pun tahu wheezing tu apa. Kan? Wheezing is an English term. So baru you tanya, okay, ada wheezing tak? Ada bunyi macam whistle tak? Ada bunyi macam berdengkur tak? Baru you go specific satu benda yang you nak tanya. Sebab dia checklist. Tapi before that, you ask an open-ended. Ada bunyi lain tak? You allow the mother to actually try and explain. Faham? Ada hoarseness of voice tak? Ada perubahan suara tak? Suara dia kasar tak? Benda macam tu. Okay. Alright. Any other question?
Doctor, so this patient have any abnormal sound or not?
So that is wheezing, yes. Okay, is that enough? Bila I said wheezing, ada wheezing. Is that enough? What else should you ask? Bila mother kata yes, ada bunyi whistle.
Nak tanya ke doktor, is it all the time or is it only during the periods of rapid breathing ke?
Okay, that's one good question. Okay, so it gets worse and more obvious masa dia ada rapid breathing. Okay, what else you should ask actually?
Nak tahu kuat ke, slow ke? Perlu tak? Like moderate at the end of maksudnya
Okay.
I want to access severity.
Cuma how do you assess kuat ke slow? Do you expect mother to tell you the decibel of it? Takkan. Does it mean
sampai boleh dengar ke?
So does it mean kalau bunyi tu kuat maknanya it's worse and slow maknanya mild?
I think that's the ending. Dia macam boleh classify.
Are you sure?
Exacerbation of asthma.
Are you sure?
No. Silent chest is more severe than.
Yes. If the sound is so slow, probably it means that the child has no energy to breathe anymore. Faham tak? So in many times, loudness does not necessarily mean it's bad. Sama juga macam cardiovascular, kan, VSD. Loud murmur does not mean it's worse. Loud murmur means it's good, it's small. Kan? So loudness does not necessarily. At the very beginning, probably loudness is important, but later on, loudness does not necessarily mean it's better. Does not necessarily mean it's worse. Okay? Alright, any other question? I sort of hear at the very end of what Atira was trying to say something. There's one thing that I don't know whether were you trying to mention that or macam mana? What's the phase? What's the phase of the wheezing? Is it expiratory wheeze, inspiratory, or is biphasic? Betul tak? Betul lah kan? Takkan tak betul. So those are questions you need to ask lah. Edina was trying to say something. Yes.
No, I just want, you just said it. You just said it.
We think alike. Okay, good. Alright, any other question? Okay. Now, what is your provisional diagnosis and what are your differential diagnosis? Can you formulate your provisional and differential now? Irdina.
Differential or provisional, doctor?
Both provisional and differential.
I think it's for provisional diagnosis. I think it's asthma, but and then for differential diagnosis, it can be pneumonia, or the rapid breathing is acute onset, right? So, tapi no, they are 4 years old. Pneumonia, bronchiolitis. Can it be bronchiolitis?
Yes, can is a if you ask can, anything is can in medicine.
Okay.
Almost nothing cannot in medicine. Can, everything can. Can is never a good question. If I ask you can, the answer is almost 100% can. It's just whether is it common or not common. Which level of differential diagnosis? The first differential is the one that is most likely, and then lower. Okay, all right, fine. Atika, provisional differential.
Can I okay. Can it be the same like Dina? Just a few changes.
Okay.
Because for me, for the provisional diagnosis, I would say pneumonia. For the DDX, I would say asthma. But I need to know more because I need to know like is there any atopy in this family? Okay. Besides that, for my DDX, also upper respiratory tract infection. Maybe like epiglottitis, but less likely lah. Other than that, yeah,
Kenapa less likely epiglottitis?
because in epiglottitis, the fever is very high and prominent, and then also the patients always has to do something like because the patient must has the sore throat, so the patient like to do something like to legakan dia punya sore throat, to like open her mouth or like that, and then other than that drooling of saliva, and also it's not there, it's not mentioned in the
So
history.
acute epiglottitis, the patient is usually severe, in a
Yeah.
severe condition, severe condition.
Very
Okay,
sad.
alright. Lagi?
Maybe
Okay, wait, cukup dah. Kita pergi pada Zakwan.
okay, thank you.
Yes, Doctor.
Cepat, your turn.
You want to know the
Provisional and differential.
Oh, provisional. Okay. I think the provisional is maybe this patient is having is having pneumonia, but this patient also have underlying asthma. But however, this admission is not due to acute attack of asthma. I think lah.
Okay, alright, next. Putri Azlan.
I think for my provisional is also pneumonia. For the either it could be bronchitis, bronchiolitis. Kalau viral croup, there's no barking cough if I'm not mistaken. Pleural effusion maybe.
Pleural effusion. Okay.
Sebab rapid breathing. There's no mention of foreign body aspiration. Broncho asthma.
Okay, alright, fine. Okay, the point I'm trying to say, the point that I'm trying to highlight to you all is, you can only ask appropriate questions if you know what is the differential diagnosis, what are the differential diagnoses. Because when you clerk a case, when you examine a case, what is the purpose, and then you present a case, what is the purpose of doing all those things? What is the objective? When you present a case, when you clerk, when you examine, what is the purpose? What is the first objective of any case presentation, of any case review?
To rule out and to rule in diagnosis.
The first one is to look for the provisional diagnosis, to get to your provisional diagnosis, because you manage the case based on the provisional diagnosis. Provisional diagnosis is how you would proceed with the management and treatment. So it's to get to your provisional diagnosis, to focus on your provisional diagnosis. That is the main objective. What is the second objective? To rule out differential diagnosis. Because as doctors, we need to make sure that we are not missing things. Because sometimes kita manage dengan something tapi diagnosis dia sebenarnya lain. So we do not want to miss things. Because in certain cases, the presentation may be similar, but if you give, because sometimes patient yang ada fever, for example, tak semua you boleh bagi whatever type of antipyretic you nak bagi. For example, patient with H1N1, if you give NSAID, for example, you can cause more problem. You can cause edema. You can cause encephalomyelitis. So sometimes treatment dia differ according to the diagnosis, even though the symptom is similar. Similar symptoms does not mean treatment sama. So that is why we need to always think of differential diagnosis. Bukan just masa admission. At each review, kita kena think what are the other differential diagnosis. And we should always rule out all the differential diagnosis. So the first objective is to confirm, to get to your provisional diagnosis. Second objective is to rule out your differential diagnosis. And I expect for year 3, you should have at least 5 differential diagnoses. 1 provisional, 5 differential diagnoses. So your history, your physical examination, your investigation should your five. Year 3, 5 different diagnosis. So, have you asked me just now enough information, enough questions to actually rule out those 5 differential diagnoses? Do you think you have asked enough? No, it's nowhere near. Okay, 2 objectives. What is the third objective?
To manage.
To look for complications of the disease. Because all disease has its own complication. Rapid breathing, pneumonia, ada complication. Asthma, ada complication. Croup, ada complication. Heart failure, ada complication. Sepsis, ada complication. Semua disease, pneumonitis, ada complication. So all disease has complications. So your history, your physical examination should actually look for all those complications that may be present. So have you asked enough information for you to check whether is there any complication that has happened on this child? No, you haven't. Okay, we've looked at 3 objectives. What is the 4th objective? Number Robert. What is the 4th objective? To look for complications of the treatment. Because everything that you do has its own complication. Not doing things also has its own complication. Tak buat apa, budak tu semput, tak buat apa pun ada complication. Kan? And even if you do anything, everything and anything has its own complication. Bagi air kosong pun ada complication. Minum air teh pun ada complication. Buat apa semua benda ada complication. You bagi sabutamol ada complication. Kan? Anak demam, bagi paracetamol ada complication. Semput, wheezing, bagi nebulizer ada complication. So think of those complications, especially kalau simptom tu dah ada few days dekat rumah. Do you think people will do nothing bila anak dia ada problem? No, people will do something, kan? And those things ada complication dia. Mak bawa pergi jumpa bomo, buat benda ni, masuk ubat punggung, for example. All those has complication. So you need to ask, dosing betul tak, apa complication yang dah ada, But you need to know lah. Kalau you tak tahu, you nak tanya macam mana kan? So you need to know lah what are the complications. What are the possible complications. Lepas tu pula kalau you clerk this patient after few days of admission, treatment may have been done. Kalau you clerk patient dalam ward, patient datang bukan direct ke ward, patient pergi ED dulu. Dekat ED, there may be some treatment done. And those treatment can have complication. Sebelum datang ED, patient biasanya pergi GP dulu. Pergi GP, you think GP tak buat apa-apa. GP pun nak duit juga. So GP akan buat some sort of treatment. Those treatment also can have complications. So it is your job to actually get all the information. What was the thing that was done to the patient? And what are the complications that may have happened because of those type of treatment? Faham? Boleh? Clear? Huh? Have you got me? Okay. So, again, your history, your physical examination, and later your investigation should cover all these 4 objectives to confirm your provisional diagnosis, because this is how you're going to manage. Second is to rule out all the differential diagnoses. And I expect for year 3 should have at least 5 differential diagnoses. And then it should look for complications of the disease. And it should look for complications of the treatment. Boleh? Boleh tak? Next time kita tanya soalan yang lebih, yang cover all 4 objectives. Boleh? Okay. Next. Next, okay. Bila kita discuss about something yang in asthma atau asthma phenotype, you need to think acute bronchiolitis, kenapa tak, kenapa ya. Tapi if you think of asthma, I'm going to go briefly. Nanti kita kena arrange another session. I don't care lah. I know, tapi we should arrange another session. Okay. If you think about asthma, you tak boleh diagnose asthma sahaja. You tak boleh kata my diagnosis is asthma. That's not acceptable. For asthma, you kena tengok dia datang dengan apa. Adakah dia datang for exam atau dia datang just for follow up? Then tak apalah. Tapi patient macam ni dia datang dengan, kalau asthma rapid breathing, maknanya dia datang in exacerbation. Acute exacerbation of bronchial asthma. Is that enough as a diagnosis? No, it's not. You kena ada severity of the acute asthma exacerbation tu. Apa, how do you classify severity of asthma exacerbation?
Moderate, severe.
Mild, moderate, severe, life-threatening. Buka PITS protocol 4th edition. Baca. Ataupun you buka GINA guideline. GINA guideline baru 2018 baru dia update. I think this year akan ada update lagi pun. Ataupun you buka Malaysian CPG for childhood asthma. Yang tu pun akan ada another update this year. Tapi at least basic for you is Pediatric Protocol for Malaysian Hospital 4th edition. So you baca, how do you classify asthma severity? Mild, moderate, severe, life-threatening. So your diagnosis should be mild, moderate, severe, life-threatening, acute exacerbation of bronchial asthma. Is that enough? No, it's not. Sebab acute exacerbation mesti ada trigger dia. Mesti ada cause dia. And you need to treat the cause as well. So, kena carilah cause dia. Mild, moderate, severe, life-threatening, acute exacerbation of bronchial asthma, secondary to pharyngitis, secondary to URTI, secondary to pneumonia, secondary to cold weather, secondary to cold drink, secondary to ice cream, secondary to terkejut nampak hantu. So secondary to what? What is the cause? What is the trigger? Kan? So mild, moderate, severe, life-threatening, acute exacerbation of bronchial asthma, secondary to apa? Is that enough? No, it's not enough yet. Dia ada satu lagi level yang you nak kena pergi, which is status or condition of the asthma. Kalau newly diagnosed asthma, how do you classify newly diagnosed asthma? You classify according to intermittent bronchial asthma, mana with diagnosis asal tadi, with underlying intermittent bronchial asthma, ataupun is it persistent? Persistent bronchial asthma ada classification dia mild, moderate, severe. So Mild, moderate, severe, life-threatening, acute exacerbation of bronchial asthma, secondary to apa, with underlying, intermittent, mild persistent, moderate persistent, severe persistent bronchial asthma. Tu kalau newly diagnosed. Kalau patient yang already diagnosed bronchial asthma, already on controller medication, how do you classify? You classify based on control. So with underlying, control asthma, moderate partly control asthma or poorly control asthma. Faham? So that is how you formulate diagnosis of asthma. Dari komponen dia, severity of exacerbation, cause of the exacerbation, and status of the asthma. Boleh? I do not accept diagnosis asthma sepotong je, no. That orang kampung boleh. Tok bomoh geng-geng anti vaksin boleh jawab macam tu. Doctors kena jawab properly. So proper diagnosis macam I told you just now. Okay, faham? So maknanya your questioning, your history, your physical examination should have enough information for you to give the full diagnosis. Severity of the exacerbation, history, physical examination mesti boleh tell you what are the information needed for you to actually classify the severity. Your history, your physical examination should actually have enough information for you to know the status of the asthma. Boleh? Acik tak? Banyak lagi nak kena buat kan? Betul tak? Banyak ni? Okay, alright. I think this is already 1 hour 20 minutes. This is way beyond. I know some people do teachings for 2 to 3 hours, which I don't think it's okay. I think 1 hour 20 minutes is it's okay lah. I think cukup lah. I think online teaching ni pun it's not as effective. I think it's better to have more frequent. Sikit you baca dulu. So balik ni, baca PITS protocol formulation, pediatric protocol formulation hospital, read about how you classify asthma. I have failed students because dia tak boleh classify asthma. And this particular student, I was even called. Why, Dr. Syed? Why do you fail this student? And I said, I have to fail him because he don't know how to classify asthma severity. And that is basic. You do not deserve to become a doctor if you do not know how to classify asthma severity. Because that is very important because it affects how you would manage the case. Okay, Aci. So baca, kita buat satu lagi session. Next time. Boleh? Get back to me. Siapa call saya? Dina itu kan? Tak apa. You get back to me. I'm here over the weekend. I don't mind. We can even do at night. Last week I'm a bit busy. Hopefully this week is gonna get much better. This week later on. Okay? Alright. Boleh? We'll arrange another session. Kalau you all nak lah. Kalau tak nak, tak apa. I don't mind. Okay. Alright. Let's end here. We will continue the discussion. Okay? Alright. But we'll continue, but we'll begin from the beginning with the same problem. Okay? Alright. Let's end our session with Tasbih Kafarah Surat Al-Asr. Okay, Assalamualaikum.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Doctor.
Thank you, Doctor.
Thank you, Doctor.